Hello. My name is Monica Brinzak from the Department of Public Health, BBU Cluj-Napoca, Romania, one of the partners of the Be Well project. It will be my pleasure to be your trainer today. This training module will focus on the communication skills that can support your interaction with patients and families. It will address the importance of communication with patients and families, as well as the context and barriers and recommendations for effective communication with patients and families. The importance of communication with patients and families, context and barriers. Please remember the general considerations on communication I made in the previous lesson. These are fully applicable in this lesson as well. Communicating with patients and their families is an important part of health and care professionals and can be considered as an important competency. More recently, there is a growing consensus regarding the components that define professional patient communication. There continues to be emphasis on both the need to teach and assess the communication skills of professionals. Excellent communication and a mutual understanding between the healthcare operators and the patients can make a significant difference in the patient's health outcomes. There is currently a consensus about what constitutes best practice for physician communication in medical encounters. Fostering the relationship, gathering information, providing information, making decisions, responding to emotions, and enabling disease and treatment-related behavior. Moreover, there is a large amount of evidence supporting the communication skills of the healthcare operators as having a positive impact on patient satisfaction, recall, understanding, and adherence, health outcomes. In reality, poor doctor-patient communication remains a challenge in many healthcare settings. In certain environments, patients may feel uncomfortable disclosing sensitive information about themselves, e.g. about substance use or sexual dysfunction, with some reporting negative experiences when they do so. Findings show that patients may be intimidated by medical staff, feel that medical staff will not listen to them, feel disrespected, be skeptical about the advice they receive from medical staff, face language and/or cultural barriers. Recommendations for effective communication with patients and families. Information shared by patients should be used by providers both as a way to build a trusting relationship and as a way to gather information. Open communication can provide a safer space for patients to share information and engage in respectful discussion with the health professional. A relationship built on trust between patient and provider can result in the patient more readily adopting the advice given by the health provider. This will result in long-term benefits for both parties, e.g. adoption of proactive health maintenance strategies, reduced consultation times, reduced costs, and better patient outcomes. There is a large amount of literature and recommendations for an effective communication of the health and care operators with patients, families, which cannot be covered in its entirety in this lesson. In this module, you may find some key principles and recommendations to support effective communication, with additional resources for further reading. A 6-function model for goals for communication in medical encounters has been developed in several versions, out of which 2 are the following. The success of your interaction with the patient depends largely on how well you assess your patient's needs, concerns, readiness to learn, preferences, support, barriers and limitations, such as physical and mental capacity, health literacy, etc. Often, the first step is to find out what your patient already knows and believes about their healthcare and condition. You can use these guidelines to do a thorough assessment, gather clues, talk to the healthcare team members, and observe your patient. Be careful not to make assumptions. Find out what your patient wants to know or take away from your meeting. Get to know your patient. Introduce yourself and explain your role in your patient's prevention and/or care journey. Review their medical record and ask basic get-to-know-you questions. Establish a rapport. Make eye contact when appropriate and help your patient feel comfortable with you. Pay attention to your patient's concerns. Sit down near your patient, with their consent. Take time to establish rapport. Taking time to establish rapport is not just the responsibility of the individual professional, but also of the setting as a whole, to ensure that professionals have enough time with their patients to do so. Therefore, health managers/workforce planners should also take this into account, for professionals to properly communicate with their patients. Gain trust. Show respect and treat each patient with compassion and without judgment. Determine your patient's readiness to learn. Ask your patients about their outlook, attitudes, and motivation. Learn your patient's perspective. Talk to your patient about worries, fears, and possible misconceptions. The information you receive can help guide your patient outcomes. Ask the right questions. Ask if your patient has concerns, not just questions. Use open-ended questions that require your patient to reveal more details. Listen carefully. Your patient's answers will help you learn the person's core beliefs. Involve others. Ask if your patient wants other people involved with the prevention and/or care process. It is possible that the person who volunteers to be involved in your patient's health management may not be the person your patient prefers to be involved with. Learn about the support available to your patient. Identify barriers and limitations. You may perceive barriers to education, and your patient may confirm them. Below are some elements of effective patient communication. Active listening and empathy. Healthcare professionals should listen carefully and empathetic to patients, allowing them to express and understand their concerns, symptoms, and feelings without interruption. Clear language. Health and care staff should deliver necessary information to the patient in plain language that the patient understands, avoiding excessive medical jargon, leaving room for clarification if the patient needs it. Open-ended questions. In order to get the necessary information from the patient, health and care professionals should ask open-ended questions that encourage providing relevant details. Respect, dignity, cultural competence, and shared decision-making. Health and care staff should respect the autonomy, beliefs, and values of the patient, respecting diverse backgrounds and cultures. Health and care staff should treat patients with dignity and involve them in making decisions about their healthcare. Time management. During appointments, it is important that patients are given time for questions or clarifications. Patients must also respect appointments. Summarize. To ensure that patients have understood and retained the information provided, it is very helpful for health and care professionals to summarize the key points of the discussion, including diagnosis, treatment, and next steps. Follow-up. Both health and care professionals and patients need to understand the importance of follow-up appointments and ongoing communication about the progress of the treatment being given and new questions or concerns. Here you can find a suggested framework on the types of roles, responsibilities, and skills that can guide professionals in communicating effectively. To go through the framework, please pause the video or refer to the transcript available for this lesson. As homework, please think of the following situation. A patient with chronic bronchitis comes back to you after several years of avoiding medical treatment and of smoking intensively. How would you approach this situation? Using the model of patient-centered communication developed by King and Hope. Now, for the reflection moment, please think about a recent complex case of a patient and how effective communication can make a difference in compliance to treatment. We are now at the end of the second module, Communication Skills for Health and Care Operators, of the course Develop Resilience for Health Operators. Thank you, and we'll meet in our next lesson.